Welcome, Professor Mike Daube, and thank you for coming all the way from Australia to share Australia's experience and take us back to some of the early days of tobacco control in the UK and Scotland. You have been working in this field for about as long as Ash Scotland has been in existence. What was it like back in those early days?
Well, first of all, it's just terrific to be here, and I'll be speaking later today about some of the wonderful pioneers from Scotland who really helped to make things happen in those early years and of course since, including the work you're doing. I started work on tobacco in April 1973. I was the first full-time director of Ash UK, and it was just a different world. There wasn't really any campaigning in those days. The industry was all powerful. The opposition, it was just immense. The first time that I asked questions at a Rothmans annual general meeting, innocuous questions like how many deaths have your products caused in the last year. After that, the chairman of Rothmans walked down a corridor with me and offered me generous funding to work in any campaign of my choice other than tobacco. I mean, the industry was just incredibly powerful, but there were some far-seeing doctors, physicians particularly, people like Charles Fletcher and Sir George Godber in England, people like Sir John Brotherston and of course Sir John Crofton and Eileen Crofton here. They saw the need for action. They established a campaigning organisation that really wanted to make a difference and to get into policy and to take on the tobacco industry. So, different world then, but incredibly exciting at the time because we were doing something new. And when you look back, yes, there are obstacles, and we'll talk about those, and yes, the industry is resurgent, but when you look back at the progress that's been made, it's just phenomenal. Look at the extent of the problem as it then was, more than half of adult smoking. Look at the huge opposition that there was. Look at the tiny resources that we had. I don't think I'd have dreamed in those days of the kind of world we're living in, where, despite all the opposition, the issue is how soon can we get to an end in smoking, rather than how can we just make little bits of progress here and there.
We have come a long way, haven't we? What would you say have been some of the highlights as you've seen them?
Well, I often say that overnight success takes time, and you don't expect to get everything instantly. I think, some of the highlights clearly were just establishing a campaigning organisation, getting consensus on the approach that was needed, and then some really key factors along there. Getting rid of tobacco advertising, just so important. Would have seemed impossible when I kicked off, but getting rid of tobacco advertising, getting strong health warnings, getting plain packaging, which is something that, thanks to a terrific health minister, we were able to pioneer in Australia. In 1981, the evidence coming through on the harms of passive smoking by an old friend of mine, Takeshi Hirayama, who published a great paper in the BMJ. That made a huge difference, and just increasing public awareness, tax increases. So, every one of those is a highlight in itself. It's a battle hard fought. But what we have to remember is that whenever we get those wins, ad bans or plain packaging, whatever it may be, we can't get complacent. We tend to sit back and say, that's great, we've achieved that. And especially the politicians like to say, well, we've solved the problem. We haven't solved the problem. We've got to keep going because there is so much more that still needs to be done.
So I came into Ash Scotland in the mid-90s, about the time that we became an independent organisation. We're now one of 4 Ashes in the UK. And at that time it was smoke-free, it was advertising, were the things that we needed to make progress on. But thinking about it now, the Scottish Government is considering its next tobacco action plan. It will publish it in autumn 23. What are some of the groundbreaking, important things that are happening internationally that we should be looking at in Scotland and thinking about?
Well, it's particularly timely because, first of all, we've got, as I said, the tobacco industry resurgence. But second, in Australia, we've got a very strong government, a strong health minister, who's just been introducing a major new program of action for Australia, which looks ahead. So what do we need to do? Well, there is an elephant in the room, and that's not just vaping, but vaping and other novel products. And of course, we have to do everything we can to ensure that they don't become a complete distraction from the actions needed on tobacco, and particularly to protect children and young people, and to deal with the tobacco industry's use of vaping to present itself as though it was virtuous. They take what Doug Betcher from WHO calls the redemption narrative. They say, well, we did terrible things in the past, but trust us now. Well, no, we can't trust them now. They're trying to sell as many cigarettes as possible to oppose any action on smoking that will make a difference, and to keep promoting their novel products of unknown harm and sometimes known harm alongside that. So yes, we've got to deal with that, counter the industry. We've got to make sure that we keep exposing the industry in the deceptive and dishonest way in which it works. But on tobacco itself, so we've got ad bans, but we've got to update those ad bans because they don't take account of all the modern media and platforms and ways in which the industry is marketing. They don't take account of lobbying. They don't take account of political donations and so on. We've got to update the ad bans. We've got to make sure that we keep strengthening our warnings, changing them, and we've got to make sure that we're regulating not just advertising and marketing, but the product itself, because the industry is making them so attractive from flavours and other things onwards. We must be spending enough money on strong, hard-hitting publication, an area where Scotland was actually a leader way back. We've got to make sure we're spending decent funding on that. We've got to make sure that our regulations are comprehensive, so they address everything the industry is trying to do. And then we've got to look forward and say, well, what can we do that's a bit new and different? Now, 40 odd years ago, a British MP, still alive, Sir George Young, now Lord Young, wanted to have cigarette warnings printed on the stick as well as on the pack. He suggested that when he was a junior health minister in the Thatcher government, so he was moved to another department. But now that's something the Australian government's considering. That's something that we should be considering. We should be doing what New Zealand is considering, which is reducing the number of sales outlets. Not stopping it, but reducing the number of sales outlets, so it's much more difficult simply to get cigarettes, especially for children and young people. I think we need overall, though, to be setting ourselves a target, not just for reduction in smoking, but for saying, let's phase out smoking. Let's see how soon we can get to phasing out the commercial tobacco industry. Now, if you try and do that tomorrow, it won't happen. But if you say we'll set a target of, say, 10 years to phase out the commercial tobacco industry, you'll be told that it's impossible. But so is everything else that we've done over time. And I think if I were advising or suggesting to the Scottish Government what it can do, I'd be saying, first of all, let Scotland show the way as it has done in the past, because in my view, the Scottish approach to tobacco and vaping and so on these days is, how can I put it delicately, is a lot more evidence-based than the approach being taken in neighbouring countries. So I'd be saying take a comprehensive approach, be strong on novel products, phase out all forms of tobacco marketing and promotion, look at new things, as I said, like the New Zealand approach that are being tried elsewhere, but above all, set yourself the target of phasing out commercial tobacco sales in Scotland. If you do that, then you're not just going to put an end to the machinations of the tobacco industry, but you're going to do what we're all here for, which is to prevent a huge amount of unnecessary death and disease.
Thank you. Can I just take you back to the redemption arc? Because I think you've talked in the past about in the 70s, in the 90s, the tobacco industry were trying to present themselves as having reduced harm products, as having light and low tar. Could you tell us a bit about those two iterations of redemption and then the current one?
Yeah, I mean the current one is interesting because it's just a new approach, but there they are saying, well, yes, we know that cigarettes, do a bit of harm and so on, but trust us, and they're trying to pretend that they're not still trying to sell as many cigarettes as possible, as they are not just in countries like this, but in low and middle income countries, and of course they're trying to promote to kids addictive products so that they then go, whether cigarettes or others, so they then go on to the profitable cigarette product. But there's nothing new in that. In the 70s, for example, and even before, we had the low tar fraud, lights and milds and filters and so on, and this was the industry saying these products are a lot safer, they're okay. And of course that turned out to be a fraud. Then we had, and I remember this particularly from the early 70s, tobacco substitutes. A huge amount of promotion by the big companies at the time, Imperial Tobaccos it then was, Rothmans, Gallagher's. They were promoting tobacco substitutes, got massive media coverage. They were supposed to be, and they were safer, and of course people called them safe cigarettes, and they were a distraction, but they were also the industry promoting a product it knew to be just as harmful as their products already on the market. And even in those days of tar and nicotine, when we're talking about those, they turned out to be producing just as much tar and nicotine as products already on the market. So from the earliest days, we've had the low tar fraud, we've had tobacco substitutes, we've had an industry that keeps presenting different types of products that are in fact similar tobacco products, and that are still absolutely harmful, but they're trying to present them first of all as though they were safe, and second as a distraction, so that we keep focusing on those and that we stop doing the work that we need to do to reduce smoking and the evidence-based work that we know will have an impact.
Professor Daube, thank you very much for joining us today.
Thank you.